Hello and welcome to the June 2025 edition of Rheum for Everyone, the video podcast of the Rheumatologist. I'm not sure you can see them, but there's some slight calluses on my knuckles right over here. That's from knocking on all sorts of materials so much while I'm in clinic, and while I'm in other places, I guess, too. And yes, I know, you can knock all you want, it's ultimately not going to make a difference in any clinical outcomes, but I would like to see a randomized controlled trial demonstrating this such. In any case, knocking on wood is an integral part of the culture of rheumatology and medicine in general. We are immersed in a world rich in metaphors, mythologies, rituals, and stories. As much as we would love to believe that evidence-based medicine can supplant these age-old beliefs, the fact on the ground is that we have to look carefully at these beliefs, since they are fundamental to our very own sense of being. Even with all our modern technological advances, we're not that much different than our ancestors, who huddled around a fire and grasped to explain the magical, wondrous world that they have left as our inheritance. Of course, speaking our stories is important, but it's just as necessary to listen carefully to the stories and narratives of others, especially those of people that we ordinarily would not interact with. Listening to those stories can bridge our differences, further our sense of mutual understanding, and enrich our own collective sense of identity. That may be just what the rheumatologist ordered. Let's talk about other great content within the pages of this month's issue, such as why should you engage in advocacy? What barriers do incarcerated individuals face in obtaining care for their rheumatological conditions? And when and where should graduating rheumatology fellows look for their jobs? That and so much more in this month's edition of The Rheumatologist. So please take a seat, knock on wood, and enjoy all the articles here in The Rheumatologist. After all, at The Rheumatologist, it is always one for all and room for everyone. Take care.